All right. Good morning. Also, good evening to our speakers as well as audience in Seoul. My name is Jisoo Kim, Director of the GW Institute for Korean Studies and Korea Foundation Associate Professor of History, International Affairs, and East Asian Languages and Literatures. I would like to first welcome and thank our speakers, discussants, and audience for joining our event today. Today's event is co-sponsored by the GW Institute for Korean Studies and Jeju Peace Institute in South Korea. I would like to thank Director In-taek Han and his staff members for helping to organize today's event. Back in April, JoongAng organized its first COVID-19 virtual event on South Korea's response to the coronavirus. At this event, the speakers were government officials and field experts, and they discussed how South Korea responded to the coronavirus during the initial stage. Today, our event is focused on the issue of reopening and how South Korea is dealing with its challenges. We think that this is very timely discussion for our audience here, especially in the US, as we are trying to move to phase 2 of reopening next week here in Washington, DC. At our last event, it was the field experts who discussed about South Korea's response to the coronavirus. This time, we wanted to hear from journalists about reopening issues so that we can approach the issue of coronavirus from diverse angles and offer fresh perspectives that are different from field experts. Now I'll move on to introduce our speakers and discussants. We're very delighted to have them with us today. Starting with Sarah Kim, she is a reporter on the national desk of the Korea JoongAng Daily, published with the New York Times International Edition. She specializes in foreign affairs and security issues, but also has covered health, education, and social affairs. She is the recipient of the 2019 Foreign Language Newspapers Association of Korea Award for Journalists. Next speaker is Victoria Kim, who is a Seoul correspondent for the Los Angeles Times. Since joining the paper in 2007, she has covered state and federal courts, worked on investigative projects, and reported on Southern California's Korean community. She has previously written for the Associated Press out of South Korea and West Africa, as well as for the Financial Times in New York. For our discussants, we have Seung Kim, who is a White House reporter for the Washington Post, covering the Trump administration. And before joining the Washington Post in 2018, she spent more than 8 years at Politico, primarily covering the Senate and immigration policy. She is also an on-air political analyst for CNN. Finally, but not least, Tim Martin is the Korea Bureau Chief for the Wall Street Journal, where he oversees news coverage on the Korean Peninsula. He has been based in Seoul since early 2017 with prior stints at the journal's office in New York, Chicago, and Atlanta, where he covered public health and the CDC. Now, briefly about the format, each presenter will have 10 minutes. We will then ask our discussants for their first round of comments and questions. Each discussant will have 5 minutes. We will then ask the presenters to respond. Then the two presenters will have about 15 minutes in total, so about 7 to 8 minutes each. We will then have the second round of comments and questions from the discussants, again 5 minutes each, and back to the presenters to respond, and they'll have another 15 minutes in total. We'll then open for Q&A for our general audience. So for our general audience, please use our chatting box to address your questions. I'll be collecting them as they come in and make sure to ask them during the Q&A session. So you do not have to wait until the end to type your questions. You can just type your questions as you think about them. So without further ado, I would like to ask Sarah Kim to give her presentation. Sarah?
Thank you, Jisoo. I'll start by sharing my PowerPoint presentation. So after a lot of heartache, basically on June 8th, which is just last week, the schools have been reopened in Korea for all kindergartners through high school, which I think Korea is one of the rare cases in the world where all the grades have opened so far. And basically this has put around 5.9 million students back to classes technically. However, we know that we are still in a trial and error process, so we'll have to see where it goes from now. So basically the new school year in Korea was supposed to start on March 2, but then the pandemic struck and students faced around 5 postponements of the school year because we were trying to wait and see how things went. And basically at one point, if you guys remember back in early March, we were the country with the second highest number of coronavirus cases in the world, and there was a lot of panic and concern. Eventually, we did try to contain the virus and flatten the curve. Currently, there are around 1,200 cases as of today and around 280 coronavirus deaths, which if you compare it to the scale of what's going on in the rest of the world, even discounting the population differences, it's still considered contained. And so basically, we eased from quarantine measures to everyday life quarantine measures on May 6th. That's when the Education Ministry announced that we will be reopening schools later in May. And after a lot of trial and error, I think we're at the point where students are back in school. So how did we get there? Let's go from there. Okay, so starting with the new school with online classes, basically in April, we decided that the students can't just stay at home for, at that point, we didn't know when they will be able to go back to classes. So the remote class system or online class system began. And basically there was a 3-step process where by each week, through 3 weeks, we had different grades come in and learn through remote classes. And at that point, kindergartners were still back asked to stay at home. And these online classes, I think, had 3 parts to them. Basically, the interactive classes through video conference between students and teachers, which we're all familiar with by now, like with Zoom classes or something equivalent to that. And then we had the pre-recorded lessons. Those are done by EBS, which is our education broadcaster and another education service. And then there are also online tasks for students to complete. And basically, we went through a lot of trial and error process of there were unstable servers. The younger kids got to kind of watch the EBS programs through online on TV. So that helped out a little bit. For students who had multiple siblings or they were not from lower income classes, we had the smart devices donated by Samsung Electronics and LG Electronics. And basically our 3 major telecom basically made data free for these students. And if a country should be prepared for online learning, I think Korea has the infrastructure to do that. However, as we all been there are a lot of glitches, but basically I think it has to do with the quality of education. Students miss being with their peers, they're easily distracted. There are some technical glitches in the beginning, but that got worked through. And then high school seniors, what the education system is like here. They're so worried about being able to go to college, if they're going to be able to get their CSAT, which is similar to SATs in the United States. And the parents were just so tied up trying to get their kids, if they have multiple kids, through their school days. So that was a difficult time. And finally, on May 6th, we sort of eased out of the official social distancing campaign into the everyday life quarantine. And the Education Ministry said that we will be returning back to school, physical campuses. And this was supposed to happen in a 4-step manner. And back then, we had coronavirus cases in the teens. So things were looking good. And then if you guys remember, there was the case of its community transmission back related to the Itaewon clubs, which sort of kind of put the society aback. And there was a lot of concern because, there was Hagwon instructors who were infected, and then some students also got infected. So there were some worries, but what the Education Ministry did was push back the start date by 1 week or so. And that kind of led to teachers having a little more time to prepare and students also being high school seniors being able to return a week later than intended. And so basically, it was around 80 days after their school was supposed to start. High school seniors, they were part 1 or phase 1 who got to return back to physical campuses. And, the first day didn't go in, all as planned because I think a couple hundred schools in the Incheon area were not able to open, or they basically began the school day and then they suddenly had to shut down because they were kind of scared about transmission of coronavirus. And basically, what the concern was that there was a Incheon instructor who was infected, and then who had a student who got infected, who went to a karaoke bar and infected a friend. So this kind of shows how community transmission can happen, and also the importance of contact tracing and figuring and testing, of course. But regardless, the government decided to continue with the opening of schools, and basically the second and the third batch of students all came back to school, and this was including the middle schoolers, the high schoolers, and even the kindergartners. And what the schools did was they implemented strict quarantine guidelines, I guess. And there are 7 classroom guidelines, as you can see, which is basically, check the health conditions, check the temperature, stay home if you're sick, open windows for ventilation, wear masks, wash hands for 30 seconds, and whatnot. And in a sense, this has been sort of effective in that when there was a case, the whole school would just shut down for that day and then revert back to remote lessons for however amount of time before it was deemed that was ready to open up again. And basically, what we can see is that the school surrounding has changed a lot for the students. If you see in the photograph here, you can see that there are plastic, how should I say it, like barriers for the students. This is sort of an extreme case. Not all schools have this, but each school can have their own kind of quarantine guidelines. The desks can be spaced apart, they have their windows open, or sometimes they have seats empty in between the students. That really depends on each school. And I'll just get back into universities really briefly, because basically I think university system is very similar to what's going on elsewhere in the world. Basically, the universities it's up to them to kind of decide what to do with opening up with the schools. And we've had similar cases where the students are kind of fed up with having to pay full tuition when they're not going to classes, physical classes, and according to them, they're not getting the full quality education that they signed up for. We had an unprecedented situation where Konkuk University, just a couple days ago, they announced that they're planning to offer partial refund to students. However, the Education Ministry today basically announced that they're not going to be enforcing refunds or government kind of funded refunds for the students, and they said the colleges are supposed to do whatever they're supposed to do. And then there's another issue, which is basically transmission, which comes through exams. And I know that in universities in the States, some of them are like smaller seminar style, some of them are very large lecture style as well. And there is concern that if there's a lot of people like getting into one room, that there can be transmission of the COVID-19. However, basically, this actually happened last month, where there was test takers in Gacheng University. It was probably the first time they were doing on-campus tests for this class, and then there was somebody who got infected, and that led to extensive contact tracing and testing as well. And basically, the other issue was online ethics and cheating, and concerns about what would happen if you can trust students or not through online exams. And we recently had a case a couple of weeks ago where med school students at Ina University cheated en masse, and what they did was they gathered into groups of 2 to 9, and then using social media or even being in person, they took the test together or shared the answers, and then later on the non-cheaters told the school administration, and then they caught on. And these students kind of faced disciplinary measures, which is basically getting 0 and then kind of getting a slap on the wrist. Some people said that that was not enough of a punishment for students because they're future doctors, for example. However, at the same time, these students were kind of flung into this very unpredictable situation where they don't know what they're going to do, and they didn't have enough time to prepare, and I think they kind of let the situation get the better of their judgments. This is just Yonsei University students today who are kind of demanding a tuition refund. And Basically, we are facing a new normal where we don't know what's going to happen. Schools are ready in Korea basically to shut down at any moment and convert back to remote lessons because there can be a second wave of infections. We don't know what's going to happen in the fall. Even the summertime, I think it's going to be really hot. So keeping the quarantine measures is going to be very difficult. But at the same time, students are just very happy to be amongst their peers, and I think teachers are also happy to have their students back. However, teachers also are very tired because they have to prepare for in physical classes as well as the remote classes and be able to kind of switch back and forth between that. So I'll wrap things up here and get the floor back to Jisoo.
All right, thank you. Well, there are a lot of things that I could relate to, especially, me working at the higher education. All right, now moving on to Victoria.
Well, if anybody has joined us since the beginning, my name is Victoria Kim. I'm the Seoul correspondent for the LA Times. And I think there's been a bit of an evolution on the topic of this seminar, so I'm not going to be talking exactly on point about the reopening. I'm going to be more suggesting that we take a look back at what's happened so far and do a review of some of the costs and pitfalls of South Korea's coronavirus success story, or what's been deemed a coronavirus success story. This image is from a nightclub that I went to recently with my very talented colleague photographer at a QR club registry outside a nightclub in Daejeon. So if anybody else is curious about that, I'm happy to talk more about that later. So just to, I would assume that most of you, unless you've been living under a rock, have heard of K-pop. The South Korean government, since K-pop success, has really tried to brand pretty much everything with a K hyphen. You may have heard of K-beauty, K-fashion, even K-seafood. There's been an addition to that list lately, which has been what in Korean is called K-방역, loosely translated means K-disease prevention. And South Korea has fared incredibly well, especially relatively and in hindsight, in the pandemic, and has been that's been deservedly a source of immense pride, both for the government and for the general public. I've heard in news reports and in private conversation, including with my own father, that people feel like the country is finally unquestionably in the camp of being an advanced or a developed nation, despite the fact that the rest of the world has long since viewed South Korea that way. The hallmarks of that response came from its past experience with the MERS outbreak in 2015, based on which South Korea set up one of the most thorough contact tracing regimes, scaled up testing at a rate that far outpaced other countries, and treated patients in hospitals well equipped with PPE and negative pressure wards. And all of that has been extensively documented and publicized, including in the pages of the LA Times. So as we begin to talk about the next phase of this epidemic, I wanted to propose that we look instead at the flip side of that success. Some read into any critique of South Korea's coronavirus response as diminishing of that success, especially since the government is enthusiastically wanting to export what they really early on termed the Korean model of the disease response to countries around the world. But as much as with any other country, it's South Korea's first time in recent memory dealing with an epidemic of this scale and this level of infectiousness. And Korea's disease response also hasn't been without its costs and its weaknesses. There are definitely immense economic costs, but that's a question and a calculation for better minds than mine. So I wanted to talk instead about social costs borne by individuals and by the society, first among them being privacy. There's been a bit of a misconception that South Korea has a contact tracing app that's done away with all civil liberties and is constantly tracking everyone's movement at any given time. That is absolutely not the case. What was central to the initial phases of South Korea's contact tracing was immediate blanket disclosures of the movements of people infected by the virus. Each of the patients was numbered both nationally and locally, and names weren't disclosed, but their gender, age, profession, city or area of residence, and movements during whatever period was deemed relevant was disclosed. And this detailed information was obtained through shortcuts that were written into the law after the MERS outbreak for authorities to receive cell tower data, CCTV footage, and credit card usage without warrants. And this information was pushed out through smartphone push alerts and published online. Early on, people were reading these with rapt attention, and resulting in speculation, like you see in this article, that one of the patients was a domi or a karaoke hostess, or that two of the patients were having an affair. Initially, it was more idle online chatter than anything else, but the cost of this really snapped into focus with the Itaewon Club cluster that Sarah also mentioned that took place in early May. Because of some of the early clubs where cases emerged were LGBTQ clubs in a country where being queer is still not very widely accepted, it really drove home how a violation of someone's privacy could have real-world consequences in employment and in family and personal relationships. A lot of people have asked how South Koreans have been so accepting of these measures, question whether it had to do with Confucianism or somehow a lesser degree of democracy. But truth is, it was probably more fear of the disease than anything else that drove the response. You had people clamoring for more information rather than less. And since then, cities and other municipal governments have modulated the amount of information disclosed after concerns were raised, including by the National Human Rights Commission. But there has really yet to be a postmortem of what the public health rationale for each piece of information that was released, nor have we really heard from those who were infected and had to fight both the virus and a torrent of public anger. The disclosures gave people a flesh and blood target of blame rather than an invisible virus, and that included people like a follower of the cult-like Shincheonji Church of Jesus, or a presumably wealthy study abroad student from the Gangnam area vacationing in Jeju, or a young clubber who went dancing at several clubs over a long weekend. And it may have been the disclosures that resulted in South Korea's virus experience being shaped by a language of blame and stigmatization of the infected individuals. And no one image probably crystallizes that than this handwritten sign that was posted at an entryway to an apartment building in Incheon. It's from a fellow resident publicly shaming one of the infected club goers who lives in the building. And it says, "I hope you're happy you got infected dancing at an Itaewon club like a delinquent." And it asks, "Are you even human?" And that's resulted in people fearing the public shaming in some ways more than the virus itself. A survey by researchers at Seoul National University found that South Koreans were, by a small margin, more concerned about the criticisms and blame they would get rather than being infected themselves. But, it's a small margin, but it's still pretty telling. And this framing was noted by a professor who worked with and studied those living with HIV. And as she said, blame and stigmatization makes the fight against the epidemic a matter of penalizing and shaming the infected individuals rather than casting them as fallible victims like anybody else deserving of protection. And as we go into the long haul of living our lives while trying to put out spot fires that will continue to emerge, shifting this language and culture will be key to setting the tone for the response in the months to come. I wanted to also raise a question of societal fault lines exposed by the outbreak. And this is no means unique to South Korea. Any crisis has a way of revealing cracks that were already there. In South Korea, the first clear revelation was in how certain vulnerable populations were being institutionalized. The country's first death came from a locked psych ward. It was a man who was 63 and weighed barely 90 pounds, and he had spent more than 2 decades in the locked psych ward where almost every single patient was infected during the outbreak. Doctors who later reviewed the conditions that these people had been living in were pretty appalled and said it should not have been so. And increasingly with some of the localized outbreaks that keep cropping up, it's become clear that a disproportionate amount of the risk in this epidemic was borne by low-wage workers who don't have the option of working from home or get paid at a level where not working or working fewer than 2 jobs is an option. That's especially been true of delivery workers, the demand for whom has shot up with people staying home and taking advantage of South Korea's impressive e-commerce and delivery services. One delivery worker collapsed and died on the job, and many others have been infected at outbreaks in distribution centers. Care workers who serviced the institutionalized vulnerable populations, many of whom are increasingly migrant laborers, have also been disproportionately infected. Foreign migrant workers, many of whom have taken the jobs in factories and farms unwanted by Koreans, have also largely been left out of the epidemic response or the ensuing economic rescue packages. So in the course of reporting on South Korea's coronavirus response over the past few months, every academic, every healthcare worker or government official I've spoken to has told me that South Korea's COVID-19 response is owed entirely to its failed, in many ways, and bumbling experience with the MERS outbreak, the Middle East Respiratory Syndrome in 2015. That disease took nearly 3 years to reach South Korea, and yet the country was caught flat-footed. And there are many examples in history of societies and countries failing to learn from past mistakes. So it is truly impressive how South Korea reviewed and revamped its disease preparedness. I think it's pretty apparent to all of us that there will be the next epidemic, the next crisis, and the next disaster. So I think discussing what pitfalls this one had, could, can, and should inform South Korea in all of our responses to the next one. I'll wrap it up there. Thank you.
All right, thank you so much. I think Victoria just touched upon very important issues such as privacy, and which is very much relevant here. We can, I think, have more discussions later about that. All right, now moving on to our discussants. Sumin could go first.
Yeah, I found both presentations really fascinating. Like my mom and my family is in Korea right now. They all live in Seoul. And my mom is a teacher, so she's gone through a lot of the same procedures of and what they've done for her is that she teaches at the school. I mean, she gets the temperature checks, the health checks and whatnot, and everyone is working, but all the students are obviously tuning in remotely, and she's complained to me about how they won't pay attention and they won't focus on that. So I really especially like that part of your presentation. Actually, one question I had for either Sarah or Victoria is, after looking through your presentations and whatnot, is the obviously South Korea had elections recently, and there were a lot of health precautions that government officials had to take. My brother talked about masks at the polling places, temperature checks and whatnot. And considering we in America obviously have elections coming up in November, and how the pandemic is affecting potential polling issues is going to be a major storyline in the coming months. I'm wondering if either of you can describe just how that election procedure went in Korea, and if there are kind of any takeaways perhaps for the United States as we prepare for our elections.
Both Sarah and Victoria's presentations were very illuminating. I'm based in Korea myself, so it was interesting to hear other journalists' perspectives on what's going on. I think, obviously the school season is not quite started yet in the US, so this really can be a sneak preview for Americans as they think about going back to school. And one of the questions I had for Sarah, Sarah's presentation dealt with, I think Vic said something about brush fires. We are seeing dozens of new cases emerge every day. Some of those have been affected and been found at school. So I'm curious how like in the States, we're thinking about the NBA or the MLB starting off. Like, what happens if a player on a team gets it? I wonder what the logic is like within the schools if they find infection from a student or a teacher, for that matter. On Vic's, really thorough take on sort of the ultimate cost of privacy. I'd be curious what her viewpoint is on whether this could work in the US. I think Google and Apple have partnered up and tried to provide, they have the smartphones, they have all the data that is available in South Korea. They're offering to slice and dice and offer up to states slightly different, a different quality of it. It's more anonymized in the US. In Korea, you basically have a full, you can crack open the brains and see everything, where you've been, who you've been in contact with. So I'd be very curious. America's a much bigger country. They certainly have different expectations on privacy. And I was very curious sort of if she thought this could work in the US.
Thank you, Tim. Well, actually, that's also the one question that I had, whether it would work here in the US, right? I think many people would also have that question. So, all right, back to you, Sarah and Victoria. You could respond to these comments and questions.
I guess I'll start off with the election question. And basically for the April 11 elections, there was a lot of trepidation on whether this will work. It was scary because this is the first time people were kind of gathering in larger groups. And there first was a very high early voting rate, which I think happened about a week before. And then overseas voting happened a little bit before that also, but that really depended on the country. Some countries just didn't open up because of the pandemic going on there. And so on the actual day of the April 11 elections, general elections, there were a lot of strict measures in place. You might have seen the photos of people standing 1 meter apart, wearing the mask, getting their hands sanitized, like the whole spiel. And Koreans are very well abiding about those things, I think. And I think elections polling ended around 6 o'clock, and then people with like symptoms or whatnot, they actually had this extra hour for suspicious people to also, or infected people to vote as well that day, which I think is, voting is a very fundamental part of democracy and a civic society where everyone can participate. So it worked out pretty well. I was very worried about what was going to happen, but even afterward, there were no any cases that were supposedly related to the voting turnouts. And we also had the highest voting turnout in general elections, and like I forgot exactly how many, but more than a decade, I remember. So I think the situation was well managed, in that I think people were determined to carry out their civic duty, which is voting, as well as carry out their other duty, which is public health and keeping with the guidelines to make sure that the transmission doesn't happen in the voting process. So we'll have to see how things go in the United States, because I know that people aren't wearing masks right now, or not everywhere, or the guidelines are kind of questionable. That's something that I might be interested in hearing from your side as well. And just quickly to the second question by Tim on the schools and what happens if there's a case within the school or within or amongst the teachers. So far, I don't think there have been any within school transmissions, but there definitely have been students or instructors, teachers who got infected outside of the school. And basically, I'll give you one example with the scare on last weekend. There was a student, a high school student, right before school was supposed to open on Monday. She went to Lotte World, the amusement park, and was later tested positive. So there was a huge scare, and basically the whole school didn't open the next day, and a lot of people, because they went to school the previous weekend as well, or previous week. So everybody got tested. What happens is that, once the student is confirmed to have tested positive, I think the school informs the students and teachers right away. They report to the local education office, because each district has their education offices as well, or city. And the school shuts down, people are tested, and if there aren't any other cases, in a couple of days they can resume the school when the school and health authorities determine it's okay. And in the meantime, as Seung mentioned, remote classes would happen. So it's kind of a system where you can kind of go back and forth. Of course, we'll have to see if there are larger cases of transmissions within the school in the future. But so far, that's what's been going on.
Just to add to your point about the elections, I went to a couple polling places, and the lines were being kept. The plastic gloves were being worn and stuff like that. But I did go to a couple rallies before election day, and those were a different question. I went to rallies for two of possibly the more popular candidates with an impassioned fan base. Who were holding rallies in the final lead up to the elections, and there was absolutely no social distancing. And I think as a candidate, if a constituent is asking for selfies or a handshake or a hug, that is a hard thing to refuse. So there was a considerable amount of that going on as well, despite like all the rules that were supposed to be followed during campaigning. A lot of those, I think, went by the wayside when it came to the moment of the rallies. In terms of the question of whether some of this contact tracing can happen in the US, well, I think the long and short of it is, like, legally, it probably would not happen, because South Korea went through a bunch of new laws enacted after the MERS outbreak that allowed for authorities to obtain some of this information without a warrant. And if I would find it pretty hard to believe that such laws would be passed in the near future and without being met with like a host of legal challenges in the US, but also culturally. The thing is, like, the contact tracing that happened in South Korea had two components. There was the tracing itself, and then there was the disclosure that went along with the tracing, like who that information was made available to. And the latter bit, I think, was possibly more debatable in terms of what the epidemiological utility was in saying, like, does it really help to know that somebody was 24 as opposed to like 74 when you're trying to see if you came into contact with that person or you may have been exposed. So I think there are a number of reasons it wouldn't happen in the US. I think from a disease prevention standpoint, the tracing is helpful. The disclosure, I think, is a different question. Does that answer all the questions?
Thank you. So yeah, I think, what's been just discussed here, I think there's a lot more to, discuss. I think we will, when we open up for discussion, I think, there are a lot of important issues to touch. But for now, I think we'll get back to our discussants to ask for a second round of comments or questions. All right, back to you, Seung-min.
Yeah, so I can actually talk a little bit about the situation here, especially because Sarah and Victoria both raised some perspectives, particularly on masks. And what we've seen in the United States is that, obviously, unlike Asia, mask wearing is not part of the culture. So it's actually really remarkable to look back at the news coverage, perhaps in late February, early March, when the Surgeon General, Jerome Adams, who is, one of the top medical officials in the United States, was saying to the public, don't wear masks. Like, it is not going to be helpful. And it would have been more helpful if the administration had said, don't buy up or wear the N95 respirator mask because we needed to save them for healthcare professionals. But the message that the administration had given out at that point was that masks, cloth or respirator or whatnot, do nothing to stop the spread, which we know is not true. It does help a little bit, and the CDC and the health officials in the administration are encouraging the use of mask wearing now. But it's become such a cultural divide for the last several weeks, and it's primarily because the President of the United States chooses not to wear one. And he has said he doesn't want to wear one. He doesn't need to wear one. People around him, he's tested regularly, if not daily. He is, and he just has chosen not to wear one. The staff in the West Wing did wear masks for some time, but now they've kind of ceased doing so. And we're really going to see that actually this week as the president resumes his campaign rallies. And this campaign rally is going to be a really interesting and somewhat kind of worrisome experiment about how to hold such big events in the middle of a pandemic. I mean, the president has kind of moved on to this reopening phase of the economy. He said in a Fox News interview last night that we are not closing down the country again, which is a kind of a pretty definitive statement when we don't know what's going to happen in the future. We don't know how badly the infections and the deaths will spike again. We don't know if there's going to be a second wave in the fall. I mean, just this week, Texas, Oklahoma, and California all recorded new highs in the number of cases in their countries. And Oklahoma, obviously, is very significant because that is where the president is holding his rally this coming Saturday in an indoor stadium of about 19,000 people. I've covered a lot of those rallies. There's absolutely no social distancing in those places. I can talk from internal newsroom discussions and discussions with my fellow reporters on the beat that there is just concern about having to cover that rally. So the Trump campaign has said, we will distribute masks at the rally. Everyone will go through a temperature check. If anyone has a fever, they will not be able to enter. Everyone will be given hand sanitizer. But the funny thing is, even if they, even if they're given masks, they're actually not going to be required to wear them inside the stadium, which would also kind of it kind of goes along with what the administration has tried to say. Like, we are recommending this, but we're not requiring it. But obviously, it's the President of the United States who sets the example for the rest of the country, and he hasn't done that, which I think is partly why there's been this cultural divide over wearing masks or not wearing masks. And the interesting thing is that his wife, Melania Trump, the First Lady, has actually done social media campaigns with her wearing a mask and encouraging the public to cover their faces. And I was actually traveling with the president down to Florida late last month for the SpaceX launch, the first time when it failed, which was really sad when we make it to the roof of where we were going to watch the space launch, and it was canceled 17 minutes before we were supposed to go. But all of his family members came, obviously, for the trip. And I just, as part of the White House traveling pool, I kept track of members of the administration, members of the Trump family who were wearing masks. And it was actually only Ivanka. Like, Don Jr. did not, Eric Trump did not, none of their spouses. It was kind of funny. Jared Kushner, who is Ivanka's husband, put his mask on when he was around Ivanka, but not when he was around the president, which we noticed when he was getting on Air Force One, and also when he was around the president. So just the dividing line, like I said, like the dividing line that we've seen over mask wearing has been just, one storyline of hundreds, if not thousands, of stories that we've seen come out of the pandemic here in the United States.
Thanks for that comment. Well, definitely you see a lot of differences, cultural, but also in terms of guidelines and, all that differences between South Korea and here in the US right now. Do you have any questions or?
Sure, yeah. So the election discussion was really interesting. Going to more of the schools, I was actually just curious, especially for younger kids, how you would handle like recesses and like playtime. Because I don't have kids. My husband and I don't have kids yet, but I know that's some of the concern that my friends who do have school-age children have discussed. Even when schools can reopen, how do you, even though we know that children are less susceptible to contracting the coronavirus, how do you just keep kids apart? You can do that in a classroom setting when they're seated at desks and there are plastic dividers, but what do you do when it's just like recess or playtime?
All right, that's a good question, and I think it's relevant to one of our audiences who've asked that question. Okay, Tim?
Sure. I think I might use this opportunity to contrast the US and Korea in terms of some of these elements that we've been talking about, which are ingredients that go into the efficacy and the ability to reopen. So we have this sort of Q&A on our website, the WSJ website, that answers some of these basic questions. But the US is still struggling to ramp up its testing. It's months into the coronavirus being a pandemic, and obviously US ranking #1 in the world. And I think the latest statistics I saw that for the US to hit its capacity, it needs about 6 million tests every week. They're at about half that. And Korea, I think, from almost day one, was sort of forcing everyone to get tested. I mean, now in the city of Seoul, any resident can be tested, even if you don't show any symptoms. I saw that the goal for the US is 100,000 contact tracers, or that's the suggested amount. In Korea, obviously, they've added some staff at the district level, but they seem to be quite ready to go from the beginning. And contact tracing played such a central role in South Korea's response, in able to identify where the disease was and where it might be traveling. And from talking to my relatives in the U.S. and my friends there, it was really interesting, the scarcity of supply at the very beginning. People had to make their own hand sanitizer. Certainly, we've seen any number of homemade face masks that they were impossible to find. I remember several Korean friends of mine in the States asking for me to send them supplies through the mail if it were possible. So it was really this sort of scarcity in the U.S. as they really had a far larger magnitude problem than we did here in Korea. And then lastly, we're starting to see some shifts in this at the state and even federal level somewhat. But this idea of what do you do with someone who's a confirmed case of the coronavirus? In Korea, almost immediately, if you were a mild case, you were sent to, in effect, like a government-run facility. They were sort of unused dormitories at colleges. Some of them were for worker dormitories or training. So there was like some LG and Samsung, facilities put in use, which they generously offered to the government at no at no rental cost. And it's interesting. In some of the journals covered recently, this guy Tom Frieden, who had been the former head of the CDC, he's now running his own nonprofit public health initiative. But his goals, and this story ran, I think, just a few days ago, his goals sounded very much like the playbook for South Korea, which they were to widespread testing, contact tracing, and isolation of people who are infected or exposed. So I'll close here. I didn't want to make it a victory lap for South Korea per se, but South Korea, they did have the MERS incident 5 years ago. I think the 2020 coronavirus will probably be the thing the U.S. officials look back to the next time there is a epidemic or a pandemic. But South Korea did catch a lucky break, and I think we should bring it up. Because they were an early adopter, if you will, of the virus, all these other countries, I think within just a couple of weeks, I think more than 80 countries had slapped travel restrictions on Koreans either going or there or the people traveling to Korea. It's now well over 100. But this was a lucky break for Korea because as the disease was migrating around the world from Europe to the US, it's now in Latin America, Koreans couldn't go there, foreigners couldn't come into Korea, and this was sort of like an indirect or an unintentional inoculation of the population. I think we can see some of the sort of structural stuff that was put in place that allowed South Korea to flatten its curve. I think the US will certainly take the painful lessons of today for the future. In terms of my question, I wanted to ask Vic if she could expand a bit more on, we have this contact tracing, and she made the smart point, it's not an app, it's sort of like an apparatus, if you will. I wondered if she had ever given any thought to the societal effect this might have on promoting social distancing. She threw up this wonderful research that said people are more afraid to be shamed about the disease than actually getting sick themselves. And I just wondered, I live in Seoul. I know that if I were to contract the disease, every single social interaction in every bar, restaurant, not a Daejeon club, but anywhere I've been might be exposed to the public. So I wondered if she would assign any value to ongoing adherence to social distancing in South Korea to the quite invasive contact tracing.
Thank you, Tim. I can say that, I'm one of those people who made my own hand sanitizer at home. Find it. All right. Okay, back to you, Sarah and Victoria.
Well, I can also speak a little bit to what's happening in the schools. Not so much for younger kids, because I went to a girls' high school on the first day that high schools opened. Schools opened first for high school seniors in South Korea because they have to get into college, which is all important in South Korea. And I spent the day there. And even for these, nearly adults, the oldest students in the K through 12 system, distancing was hard. And these were kids who had not seen their friends in about 5 months. It was a high school in Jeju, which was the center of the outbreak. in South Korea. So all of them had been on lockdown for months and hadn't seen their friends in a really long time. And there was hugging, there was hand holding, there was a lot of like excited squeals and jumping around with arms linked together. And there were teachers in the hallways saying like, you know, get apart, like don't touch each other. And I think it was tough for the teachers to do, but it was also pretty clear that as the days went on, like this was the very first day, that it was going to continue to get harder and harder. So if the oldest students are like that, I can only imagine what it would be like for the youngest of kids. So I think that's just natural. They were trying a bunch of things, including the plastic barriers. It was mostly reliant on students trying to enforce themselves and teachers trying to kind of patrol the hallways and try to tell the students to stand apart. There was some tape markings on the floor, like for example during PE they had taped regularly spaced out intervals on the gym floor so that students would stand in that distance. And then they were trying to, you know, because they had to do things like do jumping jacks wearing masks. So I think the teacher had them not doing very much, but this is all also going to continue to get harder as the summer goes on. And it looks like we're in for a hot summer in Seoul this season. In terms of what you were saying, Tim, about the inadvertent effects of these disclosures, I'm certainly feeling it myself as much as you have, that it is sort of, it also by the fact that some of the information disclosed has included in limited cases last names and nationalities. So for a lot of South Koreans, it's pretty anonymous to be a Kim who is a South Korean national. If you were a Martin and an American national, that would be a different question. So
I don't go outside, but I know that I would be found out immediately.
And there is that inadvertent effect, and that could certainly be chalked up to a positive. There could certainly be an argument made that is not really a worthy way of enforcing this type of social distancing, that the cost of the chilling impact overrides the benefits of it. But there could be arguments made in both directions, as far as I can see.
I guess to expand on how social distancing is happening in school and also for the younger kids, if they're recesses and what happens. Around 10 years ago, I actually taught English to kindergartners and elementary students. So I know that it's impossible to keep younger kids apart. And back then we had the foot and mouth disease. I think that was what was going on when I was teaching. And then, we got these kids to wash their hands every break, but kids, they drool everywhere. They touch each other. We enforce the rules, but they know what they're supposed to do, but everything else that they do in between, it's very hard to monitor kids. And Victoria touched upon it, right? There are all the measures in place, depending on the school. Sometimes you have the plastic partitions. For example, the only time you're supposed to take off your mask are when you're eating, so that's lunchtime. And some cafeterias, they say like only, sit every student apart. Some have the partitions. But the reality is, kids will be kids. They don't have the same kind of dangers in mind, and they will stick to each other. And teachers, I know I've spoken to some, they just lament that there's nothing that they can do to make kids listen. And that's just the case, I think, even in non-pandemic times. But I think even the younger kids are aware that there is something going on, and they're aware of what they're supposed to do. However, are we going to be able to keep up with the stringent social distancing measures in classrooms? That's probably going to be very, very difficult. That's why the other measures in place that, Tim kind of asked about as well. If there is I hope there isn't, but if there are transmissions within the school, can early measures be taken to kind of contact trace and lock that down, and then make sure that whoever is affected are quarantined? Basically, our education minister, Yoon-ae, in May, when she announced the reopening of schools, said that if we don't open now, we don't know when we're going to be able to reopen the semester again. So that was kind of taking the risks and balances of, the having education for kids versus, safety and health. And I think it's kind of a trade-off with each other. I think it's a risk that parents, teachers, and students are willing to take for the sake of education. However, we'll have to continue and see if there are not more community transmissions going on. And also, I think there is also a system where not all schools have to shut down, depending on the location. If there was, for example, the cases in Incheon, it was the Michuo ward, and that just shut down, and some of the surrounding districts. So I don't think kids are able to social distance. What can we do to kind of minimize the impact if there are cases in the future? I think that's what we have to look into.
I've been joking that there's been no better time in Korean history to be the loner kid at school because everyone else is sort of far.
Introverts thrive in the coronavirus pandemic. But,
For sure. And I think Vic forgot the most important detail from her visit to the high school, which is she was confused for a student.
Very happy. It's been a long time since high school.
Well, all right, thank you so much. So, well, I would like to mention to remind our audience that you can address your questions on our chat box. We currently have just one question, but you can, please, if you have any questions, please write them in the chat box, and I'll make sure to ask them to our participants. All right, this one question that we have is, it's not what we've touched upon right now, but maybe if you could, explain more in detail. So the question was about how is social distancing being done inside schools and universities. So I guess we just talked about how, kids can do social distancing at school, but maybe we could sort of, broaden that category to, bigger, like, bigger kids like in high school or even in the universities, how students can do social distancing. So for example, in school, in classrooms. So this is also actually, one of my concerns, because we'll be going back to campus this fall, and how are we really going to do social distancing? And, what are some of the measures that South Korea is taking? So for example, if you are to enter a classroom, do you take temperatures, and do you make sure that you wear masks, and do you, wash your hands before, or use hand sanitizer before entering the classroom? So what are some of the more detailed measures that the schools or universities are taking right now?
I'll get started. Actually, I didn't get to touch upon it in that much detail in my earlier presentation, so I'm glad to have this chance. And basically, schools are advised not to have all the student body in session at the same time. So that might be something that might be happening at the university level as well. So students are divided up into having the in-person classes and remote classes. So not everybody is at school at the same time. And if the school allows it to have less people in each class, that's another kind of measure that's being taken. As to the everyday process, I mean, depending on the school, I think it depends on the resources that each school has. Some school has everything in place imaginable, and then there are schools that probably don't have the finances or the resources to do everything. But something that can be common is, temperature checks or the thermal screen checks that you see in a lot of office buildings and buildings in general in Korea at the moment. And then there's the mask wearing, as we mentioned. And in the warmer weathers, I think there was a lot of worry about the KN94. That's the thick ones that's anti-pollutant proof. There were worries that it's going to be too hot and suffocating. So our government basically said they're going to produce the thinner, more, breathable masks, I guess, for the summertime. And that went into sale last week as a part of our public mask system, where we can purchase up to 3. Now we can purchase up to 10 masks per person starting from today. But that's in place. And within universities, the older students, that was as part of the question as well. And I know that not all schools have gone back to campus. Some schools have had minimal, those for example, med schools or whatnot, where physical classes are necessary. They've had smaller sessions. Some cases with testing, exam taking, those who can't take it remotely, they've had in-person testing as well. And so far, I think it's been working, but we'll have to see, I think, what the universities decide, because it's up to them right now to decide if they're going to completely reopen or not. Currently, there are a lot of worries with the university students because they're a lot more mobile than the lower grades, the 1st to 12th graders, because that is sort of a controlled setting where there's teachers and authority and whatnot. With universities, it's a lot more flexible about with students coming in and out, and they travel or they come from different sections and different districts and whatnot. So there's a lot of worries how universities will be able to contain the virus.
Just to add to that a little bit, less so for schools because I'm not really familiar with, except for this one school that I visited for a story, what's going on in the universities or in schools. But generally in South Korea, there was never the type of lockdown that occurred in the US. There were never blanket restaurant closures or blanket bar closures. So restaurants don't have the spacing out that some of the restaurants as they reopen in different communities in the US are having. So restaurants have been packed, bars have been packed, subways have been packed. And I think it is, except in institutions where it's enforced like in schools, it is going to be up to the individual to remain vigilant. And I think we really felt the relaxation in Seoul when the number really dipped to, I think it was under 5 at some point of daily infections, and it really seemed like we were close to the finish line, and then it really sort of unraveled from there. So I think it is up to the individuals, and it hasn't really been as foolproof as it may seem from the outside.
I can answer the sports question, but basically, baseball was the first to start reopening, and I heard that it's been televised in the States as well. However, sports have resumed their games. Basically, they're doing it in stadiums without audience or spectators, pretty much. Victoria mentioned earlier that we never went into full lockdown mode as compared to some other countries. We were never imprisoned. People were never in prison, sorry. I don't know if that's the right word, but I found out for the first time that journalists were essential workers, actually, this time around. However, so things are done differently in that, people wear masks, they follow the social norms and regulations, and they have been continuing on with their daily lives, even at the peak of the pandemic in Korea, I think, which is late March. So I'll transition on to the second question about teleworking at home and how that's going to affect the future of office life in Korea. I've spoken to a lot of my friends who have been teleworking at home, but that's kind of a privilege, as Victoria mentioned earlier in her presentation. Those who have such full-time jobs where they can telework, that's a privilege, whereas opposed to the part-time workers or non-regular workers, we call them in Korea, who don't have the full contract. They are the ones who are out there who have to be at the front lines of everything in terms of delivery, in terms of wrestling multiple jobs. So Korean office workers were less impacted, I would say. And then even retailers and shops, I haven't seen none of them really close down during the peak of the epidemic either. So we'll kind of have to see how things go from there.
Just to piggyback off what you said about baseball, just because I went to opening day games in South Korea. I'm sort of fulfilling everybody else's wishes as they're stuck at home in the US. Opening day of baseball here, and they were also supposed to do things like the players couldn't high five each other. nobody was allowed to spit, which is a big deal in baseball because of chewing tobacco. So there were practices like that. And they were saying at the time that they would phase fans in fairly soon because anybody who knows South Korean baseball knows that the fandom and the insane cheering and rituals of baseball fandom is a big part of games here. But that still hasn't happened, and that largely has to do with the recropping up of cases after what seemed like a near end. In terms of offices, another thing that I will mention that happened here that I don't think has been happening in the US, and that is because most offices in the US, I would presume, have been shut down. Here, for example, if there's been one case in a giant office building of, say, a branch of LG, they've closed down the entire building to disinfect the entire building. And that's, I would imagine, is a very costly process. I think the finances of that will probably be tallied up at a later date, but they have been making those kinds of extraordinary measures of, like, if there's been one case, and they would shut down the entire building and try to get pretty much everybody tested and all the floors and surfaces sanitized.
Whether we'll be able to do that here in the US. Because I mean, so far, we've been all working home, teleworking, and once we return back to workspace, I wonder how things will take place. So there's one question about whether senior teachers and professors are returning back to work. So for example, like in our university, there's this guideline that if you're over 65 or if you have underlying conditions, you can apply and you can basically teach on 100% teach online in the fall without coming back to campus. So is there any measures like that in South Korea at universities or in high schools or at just public schools in general for elderly?
I'm afraid I haven't heard of such measures going on. And as mentioned earlier, basically we never completely shut down. So I know that professors that I've spoken to and interviewed, they're always in their offices when I call them for like quotes and whatnot. And it seems like they've just continued with the work. And that also goes into the question of, how students have been demanding for refunds of their tuitions, because they're saying they're not getting the full quality of lessons, but they've been doing remote classes. Well, the professors and the school faculty basically have been saying they've been doing the work. And in fact, what's being saved in terms of, tuitions is not really, or kind of fees, is not being saved because there's extra work going on into producing those remote classes. Not all elderly professors are technically savvy though. A lot of them are, I guess. So basically what they're saying is that though school's not opening, the faculty is still running and operating and doing all the work. So it doesn't make logical sense for them to refund the students because school's still happening. And also the Korean school year starts in the springtime well, I think everyone here is Korean, so they might know that, but just for reference.
All right, great, thank you. So I have I have one question that I would like to ask related to privacy issue. Well, some experts actually here in the U.S. stated that Korea was not a free country like the U.S. and so that's why it's possible for to do digital surveillance and like the contact tracing, which is also happening in many other places in Asia. But I don't know whether you agree with that, but that South Korea is less democratic. But I think what my question is, we obviously know there are a lot of issues when it comes to privacy, right? And doing this contact tracing, obviously they conflict. But in order to really contain the virus, this may be a necessary step to do necessary measures to take. My question is, what is South Korea? I know they've faced a lot of problems with this, as Victoria went through in her presentation. So what are some of the what South Korean government trying to do to overcome these problems that emerged as they're doing this contact tracing?
So it's been an evolving process here as much as anywhere else. And as I mentioned, like there is the contact tracing bit where they track down everybody who's been in contact. And then there's the disclosure bit where they sort of push the information out to the public in terms of like where an infected person has been in the past 2 weeks or so when they may have been potentially infectious. And in terms of the disclosure, South Korea has very much sort of modulated the information that it discloses. Initially, it sort of depended on which district within Seoul or which small city was doing it. It kind of was all over the place. And in some instances, like people knew which apartment complex it was. And in some cities gave out last names, many others didn't. And it would be, sometimes it would be to the level of like bus number 9 between like 11:09 a.m. and 11:13 a.m. between these stops. And in some instances, it would be, like the name of a restaurant or stuff like that. And a lot of that has really been sort of wound back. A lot of the disclosures now are only what is deemed to be relevant. And that is sort of it is a very a subjective measure that is going to be applied to in each individual case. And also this information about the movements of the infected people are now being deleted after 2 weeks. Like that doesn't prevent anybody from saving it and then continuing to hold on to it for their private purposes. But in the official websites of the municipalities, they are taken down after 2 weeks. So authorities here have been very cognizant of that problem and are trying to be sensitive to potential problems that may arise. In terms of the CCTV and surveillance, I think that's a completely different question. Some of it might be a cultural difference. Ever since this outbreak, I have certainly noticed many more CCTVs at various corners, like a park that I grew up near that I've been going to since I was in elementary school. I all of a sudden realized there was a giant CCTV that says multi-purpose CCTV. It's not there for any other reason it's there for apparently an indeterminate purpose of whoever sees fit. And that's probably, I don't know enough about the sort of the thought process behind the installation of those CCTVs, but there is certainly a much more of a acceptance to that type of footage, and I haven't heard as much of a backlash as I would anticipate in communities in the US to that. And the CCTV footage has been a part of the coronavirus contact tracing, and I'm sure if stuff like that had happened in the US, you would also be met with some resistance and some lawsuits potentially.
All right, thank you. Well, I would like to ask, since we are almost running out of time, I would like to ask our participants and also speakers, also as well as discussants, Seung and Tim, if you have any final comments to make in terms of how maybe if you could perhaps talk about how US could learn from South Korea's case, or what are some of the challenges that's lying ahead of us here as we are trying to reopen.
I mean, time and time again, covering the coronavirus debate unfold over the last several weeks, particularly on Capitol Hill, I have heard repeatedly from senators questioning administration officials, why can't we be like South Korea? South Korea did X, South Korea did Z. Why are we not implementing similar procedures here? And I think this discussion has done a great job of outlining why there would be certain difficulties to, literally export policies and procedures of what South Korea did to here, including the privacy issues and whatnot. But I think some kind of takeaways that we are going to be watching here in the United States is definitely just how, because South Korea has been so ahead of us, just how you guys handle reopening of schools, the economy, or reopening of schools, how do you handle how the virus acts in the heat and the different behavior that people have in the summertime, because we're kind of heading into that phase now. My concern, though, and I don't know what kind of the attitude is like in South Korea, maybe there isn't a direct parallel, because as you said, there wasn't this dramatic lockdown of the economy as there was here in the United States. But the the focus really, led by the president himself, the focus in the United States really has turned to reopening of the economy, and they're just kind of trying to leave the pandemic kind of behind in history, even though we know that, there could be a potential second wave in the fall, that health officials are still trying to sound the alarm. And yet the government, our senior leaders in government are really trying to return to that sense of normalcy. There isn't, and a lot of it is also external factors. Obviously, we've had weeks of very, serious debate and concerns and unrest about race after the death of George Floyd in Minneapolis, and that's consumed a lot of the news coverage and the focus of our policymakers in the White House. But we'll be taking. But it is actually kind of dramatic how much focus has shifted away. On Capitol Hill, for example, there was so much. Congress passed a $2 trillion package in a matter of days, which is just unheard of. Of an economic package and a rescue package that large. And it's only a couple of months later after that, the unemployment rate is still in the double digits. You had another 1.5 million people file for unemployment claims last week, according to the numbers that were released this morning. But now what Capitol Hill is not talking at all about a second, like multiple rescue packages, even though economists from the right and left have said that's going to be a necessary thing in the coming weeks. So I think the concern to watch here is just how much the attention and the focus from policymakers shifts away from, dealing with the results of the pandemic, because it's still very much alive. It is still very much serious. And I know that we will be very closely watching how South Korea handles the certain phases of the pandemic, as we've been watching already so far.
All right. Anybody else? Just we are out of time, but maybe briefly.
Just briefly, I remember having a conversation really early on when South Korea was in the thick of things with an epidemiologist in the US. And the numbers were, it seemed at least at the time, were pretty low in the US. And I remember him telling me that he was really concerned about the disparate responses that were going to happen in each state. And South Korea has the advantages of being a small country and a very centralized country in its government response. And it was interesting to see what his concerns playing out just in a matter of weeks. So that is something that probably can't be taken from South Korea, because that's just the way the American system is. But and it's over here as well. I think in South Korea, people have also been watching with interest and concern the unfolding of things in the U.S.
Thank you, Sarah.
I just wanted to briefly answer some of the questions. First one about public sports events. We had a Kia Women's Open today, right there. And I think we had the KPLG game earlier last month. Second question was about how are we going to fund all the quarantine facilities and whatnot. I'm sure we're going to be seeing some tax increments in the future. And lastly, what sort of model there will be for pandemic outbreaks. I think what we have is the K-quarantine process, but I think that's a just catchy name. It can be applied everywhere. Basically, extensive testing, isolation, contact tracing, and then also public transparency and public cooperation. I think that's a good model to follow for any country in the world, regardless of where you're located.
Well, thank you so much for your insightful views and fruitful discussions. Well, just one announcement for our GWIX event next week. So we'll have another virtual event focusing on the USRK cooperation in the COVID-19 era with journalists. And so hope many of you can join us once again. And well, I would like to thank again our presenters, discussants, and audience, both here in South Korea, and especially for those of you in South Korea for staying up so late. Have a great day for those of you here in the US, but good night to those of you in Seoul. All right, well, thank you so much, and we hope to see you again. Thank you.
Thank you. Thanks for having us.